Here's $1,000,000 question I get asked every single day. Which facelift technique will give you the best results for your face? Hi, my name is Dr. Roy Kim, and in part 1, we explored how facelift surgery evolved from those early skin-only procedures to today's sophisticated SMAS-based techniques. But here's what most people don't realize. There are actually several different ways we can work with your SMAS layer, and your individual anatomy determines which approach will give you the most natural, long-lasting results. Today, I'm going to break down each technique, explain how they work, and most importantly, help you understand which anatomic factors determine what's right for your face. Let's start with SMAS plication, which is one of the more popular techniques among plastic surgeons. Think of it like tailoring a suit, and instead of cutting fabric away, we're folding and tucking the SMAS layer to create a better fit. Here's how it works. I make an incision, lift up the skin, and then look at the SMAS. I then fold the SMAS onto itself and secure it with sutures. It's like gathering excess fabric and stitching it in place. The beauty of this technique is its versatility. We can pull vertically for neck improvement or at an angle for jowl correction. Another advantage is that if you need volume in certain areas of your face, we can tailor the layering of the SMAS to give you volume in a hollow area, typically in the cheek area. This technique is perfect if you have mild to moderate aging, your skin still has good elasticity, you have some jowling but not severe, and you're looking for natural enhancement rather than a dramatic change. The safety profile is also excellent. Complication rates typically are less than 2%. The surgery time is shorter, and recovery is typically 2 to 3 weeks. Because we're not removing tissue, everything feels natural. However, the trade-off is that the improvement in the mid-face and cheek area is more subtle. It's not as dramatic compared to deep plane facelift techniques. Now, if you need more significant improvement, we have SMAS excision, also known as SMAS-ectomy. In this technique, I actually remove a section of tissue rather than just folding it. Think of it again like custom tailoring, where I remove excess fabric entirely. This gives a more dramatic, longer lasting result, but it's a slightly more complex procedure and requires greater surgical expertise. The high lateral SMAS technique is a different technique, focusing on the mid-face and cheek areas. Instead of working broadly across the face, I concentrate on lifting the tissues around your lower eyelid and upper cheek. This is great if your main concern is mid-face volume loss or if you want to address that tired, hollow look around your eyes and specifically the lower eyes. For comprehensive rejuvenation, there's another technique called the extended SMAS, which works on the larger area of your face and neck. We're essentially addressing your entire facial framework in one procedure. This technique is ideal if you have significant aging across multiple areas and want everything addressed simultaneously. The composite facelift takes a different approach entirely. We lift up your skin, SMAS, and the muscle around your eyes as one complete unit. It's like moving an entire section of wallpaper rather than individual layers. This technique is great for patients who need both facelift and eyelid rejuvenation. There's yet another technique, the MACS lift, MACS, minimal access cranial suspension. This uses smaller incisions and focuses on vertical lifting with internal sutures. It's perfect if you want improvement, but with less invasive surgery and faster recovery. Now we come to one of my favorites, the deep plane facelift, which I consider the gold standard for comprehensive facial rejuvenation. Dr. Hammer pioneered this technique in the 1990s. It did go away for a while and it's made a roaring comeback. Here's what makes the deep plane facelift different. Instead of working on top of the SMAS layer, we go underneath it in the cheek area and we release the ligaments that anchor your facial tissues. Everything moves as a smooth, connected single unit. It's like renovating the house at the foundation, the structure, and redecorating the rooms. The deep plane facelift technique provides the most natural looking results because we're working with your anatomy the way it was designed to function. The tissues move naturally, more holistically. There's no artificial pulling, and the results can last for years. The deep plane technique is ideal for patients with significant tissue descent, especially in the mid-face area. If you have deep nasolabial folds, substantial jowling, and a lot of volume loss in your cheeks, this technique addresses all of those issues comprehensively. Your chronological age isn't the determining factor. It's really all about your specific anatomy and the degree of structural changes you desire. The trade-off is complexity. This requires significant surgical expertise and specialized training. A deep plane facelift usually takes a little longer, recovery is also a little longer, but for the right patient, the results are transformational. So, how do I determine which technique is right for you? It all comes down to your individual anatomy and aging pattern. If you have good skin elasticity and mild jowling, SMAS plication or SMAS-ectomy gives you beautiful, natural results with minimal risk and downtime. If your main concerns are in the mid-face, hollow eyes, under eye bags, or that tired look, the high lateral SMAS, extended SMAS, or composite approach will typically address everything comprehensively. The max lift is good for patients who want improvement but prefer less invasive surgery. It's also great for patients who've had previous procedures and need a refresher. The deep plane facelift becomes the ideal choice when you really have significant tissue descent, especially in the midface, combined with deep nasolabial folds and substantial volume loss. It's also the best option if you want the longest lasting result and are willing to invest in a more complex procedure. Your bone structure also matters. Patients with strong cheekbones and defined jawlines often get excellent results with any technique. But if you have softer facial structures or have experienced significant volume loss, the more comprehensive approaches like extended SMAS or deep plane will give you better outcomes. Which facelift technique sounds most appropriate for your concerns? Let me know in the comments what resonated with you. And if you have any questions about any of these approaches, I'd love to answer them. At this point, you should understand the different approaches to SMAS surgery and how your individual anatomy determines the best technique for you. But here's what's fascinating. Modern facelift surgery doesn't stop at just addressing your face. For part 3, we're going to be talking about how endoscopes, mid-face approaches, and other smaller procedures may end up being enhancements to your actual facelift. If you like this video, you'll probably like these other videos in this facelift series. Thanks so much for watching.